Hello doctors, this is Dr. Salman. So welcome to MCQ of the day. Here is the question: what is the best option for TB disease prevention? So must emphasize on this portion, on this part of this word, the best one. So the best option for TB disease prevention either is a BCG or it's a chemoprophylaxis you are going to give or treatment of the diseased patient. Although this is not a complete question, but we will try to get the correct answer. So first, I just wanted to show you this Toronto notes. Here you can see in case of prevention, primary prevention, we have airborne isolation for active pulmonary disease. So we can isolate the patients or those who are having active pulmonary disease. Second one is BCG vaccine. But BCG vaccine, 80% effective against pediatric miliary and meningeal TB, and effectiveness in adults debated. So the thing which is debated, we should not go for the best option, right? So we'll keep BCG aside, but we'll keep this airborne isolation for active pulmonary disease. And third one is secondary prevention, that is chemoprophylaxis, and we'll use this rifampicin or isoniazid and rifampicin combination. So keep this in your mind, chemoprophylaxis, and keep this in your mind, airborne isolation for active pulmonary disease. But why we are not choosing BCG vaccine here? Because there's something which is in debate, or only in children we should keep this, not for the best option, right? Now I just wanted to show you first this guideline, WHO guideline. Here you can see prevention of tuberculosis. This is WHO guideline related to prevention, diagnosis and treatment. So early diagnosis and prompt effective treatment of infectious cases. Of course, this is a preliminary thing. We have to diagnose and we have to give treatment to those particular infected patients. This is first and foremost. The first thing is the initial one, but it's not mandatory that the first and initial thing should be the best one. Okay, so I just wanted you to emphasize the word initial and the best. So early diagnosis, treatment is the preliminary first and foremost initial thing, but it doesn't mean that you should go and choose this for the best option. Now the second one is good infection control, isoniazid preventive therapy. This isoniazid preventive therapy is also called chemoprophylaxis. So chemoprophylaxis is here, point to be noted. Now, how can we prevent TB disease? Best BCG vaccination, that's the first thing. Isoniazid preventive therapy, that's the chemoprophylaxis, and this is especially for HIV person, right? So here in this question, we are not bothered about the particular specific group. Here we are just discussing broadly, right? Because the question, it's not mentioned here that in HIV person or there is no specific group. So in your mind, you will think that you should leave those specific groups behind and you will think broadly. Okay, and the best one, not the first or most initial one. Okay, then we have, I wanted to show you this guideline related to WHO BCG vaccination, that BCG vaccine has a documented protective effect against meningitis and disseminated TB in children. It does not prevent primary infection and more importantly does not prevent reactivation of latent pulmonary infection. So see, it does not prevent primary infection. So does not prevent primary infection, we will leave this BCG behind. This should not be our answer. Then I just wanted to show you this Harrison book, one of the greatest book of internal medicine. So BCG vaccine is recommended where? Usually at birth in countries or among population with high TB prevalence. So this is the thing which we should not take as a broader perspective, right? Then this is very important point, that HIV infected adults and children should not receive BCG vaccination. So then again, there are some contraindications. So we cannot choose this BCG as the best option for prevention of TB because there are some again restrictions like if the patient is HIV, we should not use it, especially in adults and children. Now, if you can see this one, a positive tuberculin test is based on the manufacturer recommendation. However, good clinical practice requires epidemiological and clinical factors also guide the decision to implement treatment for latent tuberculosis infection, and that active TB be definitely excluded before the initiation of chemoprophylaxis. Chemoprophylaxis, that the use of isoniazid and rifampicin. So you can use this chemoprophylaxis once you exclude the active TB. How you will do that? You will do the chest x-ray. First you do PPD testing, tubercular skin testing. If it's positive, you will go for the chest x-ray. If chest x-ray is normal, don't worry, but still we have to give prophylaxis because of positive PBD testing, right? But if the chest X-ray is abnormal, then definitely you will go for the sputum stain and you will go for the testing and you will diagnose this as active TB. So for active TB, the regime, the protocol, the treatment is totally changed. But for prophylaxis also, but for PBD testing positive, but there is no active disease because chest X-ray is normal, for that also we have to give chemoprophylaxis, but the dosage and regime is different. Okay, now see this point also. The potential candidate for treatment of this latent TB are listed in this table. This table I will show you here. This intervention, preventive chemotherapy and chemoprophylaxis based on the result of large number of randomized trials. So see, there's large number of randomized trials and these are all the risk group. If we can see the chemoprophylaxis, we can see if there is any risk group factor, again we can utilize this chemoprophylaxis here. We can utilize chemoprophylaxis in recent context of patient with TB, in organ transplant patients, in person with fibrotic lesions, person immunocompromised, blah blah blah, all this, and see low risk persons also. So for chemoprophylaxis, we have all risk factor groups here. There we can give chemoprophylaxis in order to prevent TB. We don't know whether it's latent TB, we don't know it's an infected one, but we can use chemoprophylaxis after exclusion of active TB and in latent TB also. Okay, so if I go back to my question, what is the best options? Are you going to choose BCG? Of course no. Why? Because BCG is very restricted towards the use in children, in outbreaks, in high prevalence areas, and we cannot use in certain conditions like in HIV, and we cannot use especially for the those patients who are having latent, and if there is any reactivation of the disease, then we cannot use BCG. So it's not a good option. Chemoprophylaxis and treatment of the disease patient. Yes, treatment of the disease patient is the primary thing, is the first and foremost thing in prevention, but that is not the best one. So what is the best one? The best one is chemoprophylaxis. That's isoniazid and inflammasome. Okay, so your answer here should be chemoprophylaxis.